After the initial injury, I thought I was going to be able to work my way through it, but through my daily life, having to cut back on workouts, having issues at work, walking up and down stairs, and that, I finally thought that, and talking to Dr. Setareh, that it's probably time to do something about it. During a training session, I had a pop in my knee, developed a lot of pain, was unable to do part of the training that I was normally doing, that I was also doing with Dr. Setareh. In speaking to him and talking to him about some of the pain and some of the things that I could do, he recommended that I get a PRP injection, which could help with the healing. Did my own research and found that it's probably my best option. So here I am.
Hey, Dr. Setareh here with truMD, and today we got Tim, one of our fantastic patients. Tim has some knee pain. We found that he has a slight strain of one of the ligaments of his left knee and also some arthritis in the knee. So what we did is we got some of his PRP that'll help him do some healing, hopefully. We're going to inject some of it right into the ligament and then the rest of it directly into the joint capsule itself. Looks like we have enough for both today. So we're going to go ahead and get started now. So we're just marking the area. This is the insertion of the ligament right here. And that's where he has the maximum tenderness as well. We're just disinfecting the area here. This is called the peppering technique. So what I'm going to do is poke the ligament a few times so that when I inject the PRP into the area, more of it sticks in the area and helps it heal more. And now we're going to go into the joint capsule specifically. This one's actually looks more complicated, but it's much simpler. We just go into the joint space. So this patient had a little bit of arthritis, which made it a little bit more difficult to get through, but we found an opening and we're able to inject the remainder of the PRP directly into the joint space. Usually people feel a little bit worse before they feel better because this causes a little bit of inflammation, but at the end of the day, we're hoping that it helps them heal and recover faster. Icing the knee at this point could help with some of the inflammatory effect, but other than that, he can go back to his daily life. We recommend taking it easy on the workouts for this first week, but besides that, he can be active and enjoy his regular life.
Everything went very smoothly, very easy. Came into the room with Michelle. She had to draw quite a bit of blood, which zero pain, very simple procedure. Then moved into another room where Dr. Setareh did the injection. He started with an injection directly into the ligament, which was painful. I can't lie, it was painful. I had to take a little bit of a break before the next injection into the knee ligament, which was very simple. Thought I was gonna have a lot of pain initially. When I got up off of the table, it was stiff and painful. Within seconds, the pain was away and I was able to walk easily, hoping for great results from this.